All right. So now we are going to start with this question number one. This anomaly was given, right? This anomaly was given, this congenital anomaly was given, uh, like in almost all the exams. And when we discuss, if you attended my lectures in the DAMS regular classes or the DFX session, which was specially designed for as a short revision program of 8 hours only, and there also we discuss high yield concepts, and we discuss the anterior neuropore, posterior neuropore, neural tube defects. This is completely the straightforward question for us, and we know the answer is open neural tube defect is the best answer over here, right? So I'm sure there was no doubt when you have looked at this question, right? Now another question which was asked was, what is the afferent for the corneal reflex? Now when we talk about the afferent and efferent of the corneal reflex, afferent will be the fifth nerve, because the ophthalmic nerve V1, especially the trigeminal V1 is the ophthalmic nerve that will be carrying the sensation from the cornea. If you touch the cotton or something with the at this position of the cornea, the input will be taken to the brainstem part. In the brainstem, the efferent will be seventh nerve, and the seventh nerve will send the fibers, and then there will be you see blink possible because of the orbicularis oculi muscle which is supplied by seventh nerve. Okay, so fifth nerve is afferent, seventh nerve is efferent. Either of these is gone or both are gone, the corneal reflex will be absent. Next question. Now, based on the facial nerve palsy, there were two questions. One was image based and one was direct question. And in the direct question, as we all know, these all questions are on the recall basis. So depending upon the language of the recall, what I have collected from lots of students, so this is the best I could get. Still, for all the questions which I am discussing now, if you find the language, if you find the option or something image is not correct or something, then I am open to all the suggestions. Please tell me and I'll make the whatever changes are required, I'll do that. Okay. And the question what I have received was, the patient had the normal wrinkles and normally he could close the eyes, so upper part of the face was spared. So in a way we can say upper part of the face is spared and lower half of the face was paralyzed on the right side. And we know, if there is element type of injury, then there is ipsilateral facial palsy. We have also taken the notes, we have seen the pathways. But in case of UMN palsy, contralateral lower half of the facial palsy will be seen. So it is the lower half contralateral on the right side. So it will be the left seventh nerve supranuclear. Yes, this question was there, and one more question was there where the kid, some child was shown, and he is not able to close the eye properly. Angle is also deviated, you can see, and the mouth is not able to close it properly. You know, angle is deviated in the normal circumstances when with the closed lips. You know, so these are the features. What we can say, it's a ipsilateral facial palsy. That's why answer will be seventh nerve or the Bell's palsy. Next question is this: the patient is not able to maintain balance immediately after roller coaster ride. So in the roller coaster ride, there will be movement in all the dimensions. Okay, for the movement in different dimensions, balance in all the planes is required, and the balance is maintained by the vestibular tract. Okay, and when we immediately stand, it will take some time to adjust, but immediately after that there is no balance. But normal circumstances, who maintains the balance is the vestibular apparatus. Okay, so vestibulospinal tract, and it happens on its own, we don't have to do anything. So it is involuntary thing, and it is a part of extrapyramidal tract. By and large, if we divide the tracts in two parts, so we can say voluntary and involuntary, which is like pyramidal and extrapyramidal. So pyramidal tract is having two further parts: corticospinal, corticobulbar. Corticospinal and corticobulbar are for the movements of the body. Corticospinal rest of the body, but head and neck part, corticobulbar fibers. Extrapyramidal, which is for the involuntary, majorly four tracts are there: rubrospinal, which controls the fine movement; reticulospinal, which controls the tone and automate the breathing process; vestibulospinal, balance and posture; tectospinal head-eye body coordination. And where is the tectum, dear friends? Tectum is nothing but it is the dorsal part of midbrain. Now this question was given which is based on the tonsillar bed. Okay, so like what has been marked as per the recall, pharyngobasilar fascia has been marked over here, so we are going to mark this. But otherwise, if you look at all the structures together, so this is the you can see this is the tonsil. Okay, tonsil is present between the two muscles, right? uh, in between those two muscular pillars the tonsil is located. But when we talk about the bed, it is a laterally what are the structures present. So lateral to the tonsil we have the capsule also. Okay, and in this in within the tonsil it is presenting with the clefts is a very important feature for the tonsil. And the tonsil is present in the oral cavity. As a whole, oral cavity is lined by stratified squamous epithelium. So stratification will be also seen in case of tonsil. Okay. Then we have the capsule. Then we have the paratonsillar vein, which is located in the tonsillar bed part. Then we have pharyngobasilar fascia. This was marked. Then deep to it we have the superior constrictor muscle, and finally we have buccopharyngeal fascia. Okay, so this is how these structures are related to the tonsil, and among these pharyngobasilar fascia was marked. Next question. Now this question, some CT scan was given and the students are saying that question was based on the diaphragmatic hernia, and the position which was given was either posterolateral or posterior. Yes, can you confirm which position was given? Because based on the position, if posterolateral was given, answer will be Bostelak hernia, which is the most common type of congenital diaphragmatic hernia. And if you remember in the regular classes, we remembered the mnemonic RAM. And I told you when you remember RAM, M for Morgagni, right? Sorry. And also we come to know the position. It is the right anteromedial. From this, we can also derive the position of Bosch-Dirac, that is just opposite left posterolateral. Was the same language given in the question, dear friends? And now this question was also given. What will be the answer? Just a moment. Okay. Right. So, dear friends, here students are saying that they are 100% sure it was male pelvis was given. But when we look at the choices, these choices are present in female, except for the Morrison pouch, which can be present in both. Okay. But vesicouterine pouch, rectouterine pouch, or rectouterine pouch is also called as pouch of Douglas. These are given. But here the marking is on the rectovesical pouch. So now, dear friends, you are the best judge. If at all rectovesical pouch was there, that is the best answer. But if it is not there, the counterpart we have to take. Pouch of Douglas is the counterpart of rectovesical pouch. We can take pouch of Douglas as the other next best answer. And in that case, D choice will not be there. D choice will be something else because the pouch of Douglas and rectouterine pouch is same. So I believe D choice will be something else. And if at all these choices were given, then we can take the pouch of Douglas because it is not exactly the same thing, but it is the counterpart. Now this question, the patient is undergoing breast surgery and during the surgery some structures have been retracted. And identify the red area arrow mark structure. So we have been given this red arrow mark structure. So basically, what is this muscle deep to this breast is present in the fatty layer in the subcutaneous tissue and in the bed where below beneath the you can say breast tissue, which muscles are present. So we can say this is the pectoralis major. This is the pectoralis major, and deep to the pectoralis major, of course, pectoralis minor will also be present, but these structures will be retracted. In the lateral aspect, this structure is serratus anterior because laterally below the breast tissue lies the serratus anterior. C will be the correct answer. And here you can see the pectoralis major muscle has been retracted for the breast surgery, and then you can see in the lateral aspect who is related to it is the serratus anterior muscle. Serratus anterior muscle has been present over here. Now this question was also there. Identify the given structure, dear friends. What will be your answer? Yes, attempt the answer. Is it morula? Is it blastocyst, gastrula, neurula? What? We know that morula is a compact structure where we have the cells in connection with each other, but we do not have such type of awareness where we get inner cell mass, outer cell mass, or the trophoblast is the trophoblast or outer cell mass, right? And this is the blastocyst cavity. Okay, blastocele cavity or blastocyst. So overall the structure is blastocyst. Yes, lateral aspect. Okay, very good. So the question's language is more or less, you are also acknowledging the same thing. More or less the question language was correct. Wherever you find it little bit different or any other changes, you feel free to tell me. Now this question was also there. And can you tell me where was the marking? Because some students are saying right hepatic artery, some students are saying cystic artery, but mostly they said cystic artery. So I have marked the this marker on the cystic artery. But otherwise, we know all the structures. This is the common hepatic artery. Of course, this is left hepatic artery, and this one is the right hepatic artery. And the right hepatic artery is giving this the cystic artery, and this is the cystic duct. This is common hepatic duct, and this is bile duct or CBD. Okay, previously we used to say it's CBD. Nowadays it is usually called as bile duct, but you can also say common bile duct, hardly matters. So right hepatic artery it was marked. Okay. So as I said, there's a conflict between the students. Some students are saying right hepatic artery, some are saying cystic artery, but we have revised everything. We have seen everything, whatever was asked, accordingly you can think should be the right answer. Okay. Now one epiphysis was asked and it was the lower end of the fibula most likely. Even if it is the lower end of the fibula or the lower end of the tibia, same thing because both of them are making the joint. And those epiphyses which make the joint, which are articular, okay, those will be pressure epiphyses. Why? Because joints they play role in two important functions. One is the mobility, movement. Joints help in movement. Second, they bear the weight of the body. So when they bear the weight, or we can say when they bear the pressure, that is why they are called as pressure epiphyses. All the joint making ends of the bone is called as pressure epiphyses. Head of the femur, condyle of the femur, or whatever part is joint making will be pressure epiphysis. But the jutting out part of the bone because of the muscle traction is called as traction epiphysis, and this traction epiphysis is non-articular. They will never form the joint. They will never form the joint. And two important structure you need to remember. वन इज कॉन्डाइल, अदर इज एपिकॉन्डाइल। कॉन्डाइल और एपिकॉन्डाइल सुनने में एक जैसे लगते हैं, लेकिन कॉन्डाइल क्या है? प्रेशर एपिफाइसिस, इट मेक्स द जॉइंट। एपिकॉन्डाइल क्या है? ट्रैक्शन एपिफाइसिस, डज नॉट मेक अ जॉइंट, राइट? बट अबाउट एबरेंट, एबरेंट के लिए it is absent most of the time, so you can say sometimes only present, and for this is some additional epiphysis only sometimes present. And what will be the typical example? Head of first metacarpal, or you can say base of other metacarpal. So normal circumstances, base of the first metacarpal is present and head of other metacarpal is present. But by chance, along with the in the first metacarpal, base should be present normally. But if by chance head is also present, additionally, base will be present always, but additionally head of the first metacarpal is also present as epiphysis, it will be aberrant. And for the atavistic, example is coracoid process and os trigonum, like that. Now here I couldn't get the complete picture, but whatever I could get was this. The student said that carpenter word was there. Carpenter present with the swelling around the knee, and some bursa was inflamed. And some students are saying the picture was given, some students are saying the picture was not given, only the language was there. If the bursa was given in this manner, it is a pre-patellar bursa, then my answer will be house-made knee. What is your take? Was pre-patellar bursa was given? And this question, which is related to the straddle injury, okay, the word straddle injury or fall on a strident object and blood on the tip of meatus, then definite answer is bulbar urethra. In case of this type of injury, bulbar urethra is prone for the injury, first thing. Second thing, in that case, the blood will be seen at the meatus. Blood will spread, okay, into the superficial pouch, even the penile shaft. It will come on the anterior abdominal wall also. It will go to the upper part of the thigh, but it won't cross the Holden line. Now this question, the patient was having numbness, tingling, paresthesia on lateral 3.5 finger, including base of thumb. Including base of thumb. In that case, we will say answer is median nerve only. It is nothing but the you can say uh, carpal tunnel syndrome. Yes, but some students are saying that okay, this is median nerve, but some students are saying that in this case, one question was given that base of the thumb on the dorsal aspect. If the dorsal aspect was given, if the dorsal aspect was given, then answer will be radial nerve. Okay. But what my belief is, it should not be the dorsum, because now the dorsum has actually changed. Earlier, palmar aspect and dorsal aspect had 3.5, 3.5. So it looks to me that if I have to take a call here, I will say that the language should be lateral 3.5 fingers, including base of the thumb. Then we will consider the palmar aspect, and that's a clear-cut case of carpal tunnel syndrome, which is a very important topic as well. Okay, and median nerve should be the answer here, even if the base of thumb is given, because the base of thumb, they are not specifically saying dorsal. Okay, but yes, at the same time, I must say, if dorsal word was there, then we have to think of radial nerve. All right. Now this question, the patient presenting with the numbness on the fourth and the fifth finger, okay, at the same time partial claw hand is also there, so we know answer is ulnar nerve. And at this exam particularly, there were three questions based on the histo. So there were direct histo exams, normal histology normally, or you can say usually till now they used to ask the uh, histopathological slides. And for us, like they used to ask epithelium, maybe the cartilage, maybe the gland. These are the usual area which we have been telling you, है ना? During the classes, regular classes in DAMS or during the DFX series, I told you the epithelium is important for us, glands are important, lymphoid tissue, and cartilage. So if you see, two questions were based on the lymphoid tissue and cartilage only. And the third question, which I told you, always I say 4 5 topics in the neuroanatomy, I say that these will be definitely asked, and one was asked was cerebellum. So the topics were all most common which were predicted, but at the same time this is the first time they have given direct slides, back to back 3 slides they are given, right? Anyway, let us move on and see if this was the slide, because there is conflict. Some students are saying this slide was there, so let me tell you how to proceed. If you see, the tissue can be divided into lobules. Lobules are there, and each lobule is having cortex, medulla, cortex, medulla, cortex, medulla. And within each medulla you see the onion ring, concentric rings type appearance. That's Hessel's corpuscles. Pink color structures are there. Hessel's corpuscles, thymic corpuscles. In this case, answer will be thymus. But in case this slide was not given, rather this slide was given, which in the first look we can see everywhere reddish pulp, and we have this lymphatic nodule with the central arteriole. If this type of structure was there, this is the white pulp, red pulp, and lymphatic nodules with the central artery, then answer will be spleen. So you are the best judge. What was given as per your recall, whether it was thymus or whether it was spleen? Now identify the given histoslide. Okay, so you said spleen was given. Okay, all right. Now this time one slide was given from the histology as for the cartilage. If the big cells and mostly single cells are there, at the same time long wavy fiber, short wavy fibers are visible, so we will take answer as elastic cartilage. But if this type of image was there, when the cells are seen in the nest, cells are seen in the groups, but there is no fiber seen, then it will be hyaline. So if the single cells are single on long wavy, short wavy fibers, then elastic. If everything is discipline, parallel fibers, parallel cells, then it is fibrocartilage. And also what they can ask in future, if you write cartilage as cartilage, so remember type 2 fiber, type 2 collagen is present in the cartilages. Whereas if you ask bone, bone will tell you that it is having type 1 fiber, type 1 collagen fiber in bone. What about fibrocartilage? It is a cartilage, but it is having 1 plus 2, and the dominant is 1. That means even though it is a cartilage, it is having the collagen of bone, and that is why very tough behavior is there. Now identify the marked cell. I told you if such type of slide, how you have to proceed. First of all, you see this cell which is neither fitting in this layer above and nor fitting in this layer below. So in itself it is a layer. In itself it is a layer. And this layer or this cell is the Purkinje cells, and the layer is the Purkinje layer. And then our diagnosis will be made confirmed by the presence of black dots. These black dots are the granule cells, and the layer is granular layer. And the third layer will be molecular. So we have molecular layer, Purkinje layer, and the granular layer. And these cells which have been marked over here is Purkinje cells. Is that all okay? So far so good. So that was all, dear friends, that were given in that I could get the recall. Okay, if you guys are there on the social media, Instagram, do follow me and be in touch. I would love to hear from you, and once you have cracked the exam, do inform me. It's your future, but for your parents and for your teachers, it's a matter of pride and happiness. Okay, we will celebrate your success. God bless you all.